Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hi everyone, I'm Dea Revinda. I will presentation about Articulatio Trochoidea with my friend Devitha Nadya.
Hai.
Okay, let's start presentation. Trochoidea. Trochoidea or pivot joint is a joint in which one end of the bone moves around or rotates the other end of the bone. The bone connected by this joint is a bone that enters the cavity of another bone ring. This joint is what makes our head can rotate comfortably. A distinct side feature of the pivot joint is its ability to move bone in a circular motion or rotation of other bones. Next.
Trochoidea structure. And first, joint capsule, which is component of the central joint structure consisting of the three fibrous covering membrane. And second, inner layer. Inner layer from connective tissue with many blood vessels. And third, synovium. The synovium that forms the line, the anterior joint, and converts the tendons that cause the joint itself. Next.
Next, the function of trochoidea. The function of this joint is to allow bones to move between one bone and other to allow them to move and perform various movements in all directions. Next.
And this is example of trochoidea. In first, articulatio radio-ulnaris proximal, the proximal radio-ulnar joint is a synovial pivot joint between the circumference of the head of the radius and the ring formed by the radial nodes of the ulna and the annular ligament. The place articulatio radio-ulnaris proximal. Next.
Next, Articulatio atlantoaxialis. This is example of Articulatio atlantoaxialis. The atlantoaxial joint is a joint in the upper part of the neck between the atlas bone and the axis bone, which are the first and second cervical vertebrae. Pivot joints, example, okay, next. Abnormality of trochoidea. First, arthritis or ANATOMI. Inflammation of the joint is caused by various reasons. Inflammation can occur due to infection by bacteria, accumulation of uric acid in the joint, and autoimmune disorders in the joint or the aging process in the joint. Complaint on age cause have their own characteristics. Next.
And then arthritis due to the accumulation of uric acid. Arthritis due to the accumulation of uric acid in the joint has sudden symptoms such as attack of severe pain accompanied by swelling of both big toes. These complaints may be accompanied by a head fever. When the acute attack is resolved, it is followed by a calm state. The calm state is the absence of pain and redness in the big toe, but is characteristic by a high amount of uric acid in the blood. People who experience joint pain due to the accumulation of uric acid have a history of increased blood uric acid. Next.
Next, osteoarthritis. Osteoarthritis is one of the most common joint disorders. This disease occurs when the cartilage that lines the ends of the bones in the joints wears out with age. As a result, the joints will feel stiff and painful, especially when moving. Adult age 50 years and over and women are more at risk for developing this chronic and progressive disease. Next,
And the last, rheumatoid arthritis. Rheumatoid arthritis is an autoimmune condition that affects the lining of the joints, immune system cells that are not normally present in the joints, instead accumulate in the joint in large number. When immune cells interact with local joint cells, the joint abnormality can lead to increased inflammation, resulting in the breakdown and eventual destruction of the cartilage and bone. Next.
okay, and the last question. Next, okay, that's our presentation about Articulatio Trochoidea from me and from Devitha. Uh, I hope you all can understand this material. Thank you for your attention.
Thank
Wassalamualaikum
you.
warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.